The COVID-19 pandemic affected everyone's health and well-being. For social partners and policymakers in the labor market, the pandemic also brought questions about protecting particular vulnerable groups. Who were the most vulnerable, exposed to poverty and job losses? What measures were adopted to protect these groups? How did social dialogue help in designing such measures? These were the questions studied in the DEFEN-CE project, implemented by an international research team in 12 countries. University of Duisburg-Essen, University of Helsinki and Tampere University conducted research in Germany and the Netherlands. In this video, we present the most important findings. Everyone has been affected by the pandemic. But from a labor market perspective, who were the most vulnerable groups in Germany and the Netherlands? We interviewed 24 German and Dutch stakeholders representing trade unions, employers' organizations, governmental bodies and various NGOs. We found that similar groups were identified as the most vulnerable in both countries: migrant workers, atypical employees like temporary agency workers, self-employed, workers in the health and care sector, young workers, single parents and people with disabilities. In both countries, well-established automatic stabilizers in the form of social protection schemes helped to downsize the impact of the pandemic on a societal level. In both countries, the main focus of the measures was to protect income and job retention as well as protecting health and safety at the workplace. In the Netherlands, the most important measures were based on trilateral negotiations. They included schemes like the temporary wage costs allowance, which ensured the company's ability to pay wages. Additionally, measures were taken to protect the self-employed, who were excluded from regular social protection. In Germany, the most important support policies were rather taken unilaterally by the government, but likewise included both measures targeting the labor market population in general and measures addressing the specific needs of more vulnerable groups. The measures included, for example, the expansion of the short-time work scheme and the facilitated access to social assistance for solo self-employed. The COVID-19 pandemic was a reminder of the beneficial impact of an existing infrastructure of collective bargaining and broader social dialogue in times of crisis in both countries. Trilateral forms of social dialogue helped to achieve the necessary support packages quickly and to extend the protection to cover vulnerable groups. This was in particular the case in the Netherlands, where a long history of social dialogue and the established patterns made interactive bargaining possible during the pandemic. In Germany, trilateral forms of social dialogue are less common. Where they existed, they helped to gather expertise and build consensus on short-term and longer-term measures. While COVID-19 extended, the role of social partners in the crisis management was seen to diminish in the Netherlands. In Germany, trade unions, welfare organizations and other stakeholders used established lobbying channels and began to articulate demands for better protection of specific groups more vehemently. Legislation became gradually more responsive towards these demands. The pandemic also proved to be a window of opportunity for novel social dialogue and regulatory attempts in some industries with a higher share of migrant workers. To some extent, the pandemic has thus been a laboratory of political re-regulation in Germany.